My name is Teresa Picaro, and I would like to share my story of living with endometriosis. I, even though I had symptoms at my first period, where I was 12, wasn't diagnosed until my 30s. I was going to doctors and asking about what was normal and what was not normal, because my mom had endometriosis. Unfortunately, even though I knew that something was wrong, I was told repeatedly that I was too young to have endometriosis, that the pain was in my head, and that I had a low pain tolerance. I actually went to the same gynecologist who diagnosed my mom and gave her a full hysterectomy at 36 and said that something was wrong, that I was bleeding from my clothes, that I was throwing up, and that I was experiencing pain levels that I didn't think were the same as my friends when they were in their periods. And he simply told me, "You're too young, you should go on birth control. It'll help you manage the effects of being a woman." I honestly internalized that until I was probably in my late 20s, and that is when things started getting a little bit worse for me. I started experiencing debilitating cramps. I was missing class in college. I was strapped to a heating pad all the time. And so I started realizing that things were not going upon graduation from college. I started to experience abdominal bleeding. I was diagnosed with liver and polyps through surgery. That OB/GYN actually told me that I had possibly been sexually assaulted instead of assuming that something was wrong. And said that maybe I didn't know my mistakes like this. It was during my first endometriosis excision surgery where I was officially diagnosed. However, I felt that surgeon did not do a complete job. I kept insisting that I had bowel endo. I kept insisting that there was something wrong. Within 3 months after surgery, I had recurring pain, and it was the same pain. And she said that my left side of my body was receding so long that I had left side pain. So I just went about my time and just kept trying to find more doctors that would try to help me, new doctors that were trying to help me, and it was the same story. My endoscopies were perfect, my nerve tests were perfect, my imaging was perfect. I was completely unremarkable, as everybody said. Until one day I realized that I just didn't want to take it anymore. So I ended up consulting with my neurologist and sharing some of the things with him that I thought were perhaps nerve related. And we got a pelvic MRI, we got a pelvic CT. I really just felt like the endo was on my nerves. So I flew to Texas. I said, you know what, there's a surgeon there that's going to be the best when it comes to endo, and I'm going to just do that. Turns out I was right. I had endometriosis on my hypogastric nerves, all over my uterine sacral ligaments, causing dilations to be. I had an appendectomy. I had a uterine septum. So all the nurses were complaining about, pain with penetration, pain with putting in tampons, bleeding all the time. This was I had endo all over different nerves within my pelvis. And honestly, I had health repair and muscle treatments through care and protocol beforehand. So the fact that I was in that nerve pain was a little bit crazy. I still now, even after that surgery, do experience a little bit of symptoms with them being managed with pelvic floor PT. And if I could tell endo patients anything, it would be ask for their images, don't let doctors tell you that pain is part of living life, and stand up for yourself. If a doctor is not going to help you, then get a new one, because I wasted over 20 years letting doctors tell me that it was in my head and that I just had a pain tolerance, and in fact that pain was being caused by disease ravaging the inside of my body.
Hello, I'm Amanda from Lincoln, Nevada. I've had endometriosis since I was 13 years old. I've had 25 surgeries since. I've had a full hysterectomy when I was 23 years old. I had cervical cancer. I've had all of these done. Now doctors are telling me they don't want to work with me anymore because I've had too many surgeries. But it's going to continue to grow. It is growing still. I had my surgery with my gallbladder. They still found endo in my small intestine, but they would not take it out because I was a doctor for it. So it's kind of just my life in a very short term. Living with endometriosis, I depressed every day, suicidal, in so much pain all the time. No one believes you. They tell you look okay, so you should be fine, but you flip this inside out. There's no way we would look normal. I throw up every day. That's not normal. I think my biggest thing is when people tell me the outside is that I look fine, so they don't understand why I feel like so shitty all the time, or crappy, sorry. And also, it's not cancer, so you should be fine. You'll live. That's a huge one that I cannot stand. Just because it's not cancer does not mean it's not as serious or as invasive like cancer. Mine does grow invasively like cancer does. I just wish there was a cure or something out there to help find for us to feel better and not to have surgeries every time that we are in pain. Because I've had 25 surgeries, I can't just continue to have more and more surgeries my entire life. So I just wish people knew more of how painful and how debilitating and how frustrating this disease is.
So one of the craziest things about my journey was that I was raised very much in like the 90s and 2000s purity culture era, where women's physiology wasn't talked about. It was very taboo, especially in my setting where I was people that surrounded me. And as a teen, when I started having symptoms and really started struggling, there was kind of this unspoken rule that you didn't need to go to the gynecologist or seek any kind of gynecological care if you weren't sexually active. And of course, I wasn't sexually active because that would have been, sending me straight to hell. So it took me a really long time to get to the point as an adult to say, no, this is my body and it doesn't feel right. I need to get care regardless of my sexual experiences, because there was this idea that like you don't go to the gynecologist until you're about to get married, and here I am, I'll be 35 in a few weeks and I'm still not married. So if I had done that, if I had followed that, I never would have gotten care, and I never would have been able to meet people and learn things about my body and learn how to take care of myself. I kind of would have still been in this embodiment of, my body belongs to my future husband. So a lot of my healthcare with endometriosis has been about reclaiming my body for me, that it is mine and no one else's, and that I know what's best for it. I know when to ask for questions, or when to ask for help, and who to ask questions to, and that is all based on me owning my own body. So for our young people, it's never too early to ask questions and get care. It doesn't matter if you're sexually active. If something doesn't feel right, ask, advocate for yourself, tell people what's really going on, and keep saying it until someone believes you.
Hi, so I'm Dr. Maria Revito. One really bad experience I went through in early 2021 is I was in so much pain driving home from physical therapy, and I remember driving down my street where my house was on, and I really felt myself getting nauseous, really, really deeply nauseous, and all of a sudden, like, my vision went blank and I passed out. So about a half mile, like 3/4 of a mile later, I came to, and my car was on top of the curb on the opposite side of the street, and people were rushing all around me and trying to figure out what was happening. And my endometriosis pain was really that bad to the point where I couldn't breathe. So I was rushed to the emergency room, and I waited there for 14 hours. And essentially, the doctor saw me, just basically told me, like, yeah, we saw your scans from, your ultrasound a couple months prior, and really, we think you just need to eat more fiber. So, honestly, as someone who has had bowel endometriosis since I was a kid, it's just kind of like fiber's not going to do anything to help me, honestly, and it's just like they just don't care. So, honestly, things aren't going to change unless we change the attitudes providers have about menstruation and constipation and bladder pain. Hello, I'm Maria Ortiz. I got my first period when I was 11. I passed out for my period for the first time when I was 12. I started getting imaging done when I was 20. I had a hysterectomy as well as my left ovary, fallopian tubes, removed when I was 37. And I didn't learn I had endometriosis until 4 years after the hysterectomy, because no doctor ever told me I had hysterectomy or I had endo. I found it out reading the pathology from my surgery. So it's kind of weird.
So before I was diagnosed with endo, I had so much back pain, and we thought it was from my back, and I had 2 back surgeries, and I was still in so much pain, and I went to see a spine surgeon, and I was throwing out all of these like last resort treatment options because I was hanging on by a thread. I was probably at the lowest point in my life when I went to see him. And when I threw out these last resort options, he actually looked at me and he laughed at me. Like, he looked me in the face and he laughed in my face. And I was just so shocked. I grew up around healthcare. I worked in healthcare. And I know how to navigate the system. And if this is how I am being treated as someone who knows how to navigate the system, what kind of treatment are other people receiving? Like, I was hanging on by a thread, and he just snapped it. And I honestly didn't know how I was going to survive that, but I did.